Hi there, I'm Coach Max and I'm thrilled to welcome you to our Cardiac Rehabilitation follow-along session. If you use a heart rate monitor, a fitness tracker, turn it on now. We want to get a baseline heart rate even before we begin to warm up. Let's talk about exercising safely, especially with heart conditions. Number one, you want to wear loose clothes that don't limit your movement. Number two, what intensity should I aim for? A great way to gauge your exercise intensity is the conversation test. Essentially, you want to aim to work out at a level where your breathing is noticeably deeper than usual, yet you can still hold a conversation. It's okay if speaking requires a bit of effort, but you shouldn't be so out of breath that you can talk. Number three, remember to have a water bottle close at hand to stay hydrated. Number four, always keep breathing. Whether during cardio or strength training, if you exercise while holding your breath, you could trigger abnormal heartbeat, not something we want. What's okay and what's not okay? Feeling warmer, noticing your heartbeat going up, experiencing moderate breathlessness during a workout, perfectly normal signs that your heart is getting a good workout. However, always listen to your body. If you experience severe shortness of breath, chest pain, irregular heartbeats, dizziness, or extreme tiredness, anything that feels off, really, please pause and take a break. If these symptoms ease quickly, you can cautiously continue. If they persist, safer to stop and save it for another day. Don't forget to report any unusual symptoms to your healthcare provider. Jot them down at the end of your exercise session to keep track of them. So, with all that in mind, let's start this exercise session focused on safety and boosting your heart health. Let's go! Hello folks, and welcome to this follow-along session. This is an intermediate level, so if it's one of your first sessions or cardiac rehab sessions at home, I suggest you do not take this class and go to our beginner classes. If you're ready for it, let's go. I'm here with Nick today. Nick, thank you for being with us. Nick will be showing you the movements you can use with the support of a chair if you have a little bit of difficulty moving. I will be showing you the regular movements. You are going to need 2 small water bottles for today. It's pretty much all you need, and a chair, obviously, if you need to. And do not forget to connect your heart rate monitor. We want to capture those data before you even start to work out. With that said, let's start with our warm-up. Our first movement for today will be small backward lunges, holding a chair or freestanding, up to you. All right, let's go, folks. Gentle for 1 minute. So while we're doing that, remember, keep my back straight, small amplitude. I don't need to go too much further back. Just a nice little lunge to get this blood pumping and legs moving, because they're going to be moving quite a bit today. That's it. The next movement will be a squat for our warm-up. So either traditional air squat, so air squat means without the support of anything, or you can use a chair, or sometimes you can even squat against a wall to hold back. All right, 10 more seconds of backwards lunges. Gentle, if you need to do less amplitude, that's perfectly fine as always. All right, so squat, let's go. Remember, back straight. I want you to go vertically, knees pointing out. The style, you can bring your hands forward. You can leave your hands between your legs. You can bring your hands up. If you want to stay a little more upright, that's fine. Do whatever you can. All I want is your knees and your toes pointing slightly out. I don't want to see inward or knees going in on the way up or down. All right. Gentle. If you can go full amplitude, that's fine. You can do a quarter squat just like that. Super fine. Just want your weight distributed on all the surface of your feet. All right. Next is marching. It's gonna be marching for a minute. And while we're marching, let me walk you through what's coming up next. So we're gonna have 4 different movements, 40 seconds of work, 20 seconds of rest. The rest will actually be a marching rest. So not as much intensity, but still you're maintaining your heart rate up. And so after this workout, we're gonna have a 3-minute cool down and it's gonna be fine, don't worry. 30 seconds more. While you're still at it, why don't you start rolling your shoulder back and forth. Start to open them up because we're gonna be using them quite a bit today. Ten more seconds. We're gonna get into our core workout with forward lunge as our first movement. All right, so forward lunge, you can use the help of a chair. I want you to go gentle for 40 seconds, you alternate. If it's more comfortable for you, I'm fine with you doing backwards lunge, perfectly fine too. I just want you to keep moving for those 40 seconds. Stay with me. Again, you don't need to go all the way down. Reduce the amplitude if you need to, perfectly fine. Just want to keep this heart pumping. And rest for 20 seconds. During your rest, we're still marching today. That's what you get when you join an intermediate class. We never stop moving. The next movement will be a standing row. So you're gonna take these 2 water bottles and you're just gonna lift them upright. Nick will do it seated, I'll do it standing. So I'm gonna keep marching. Nick will just do the standing row portion, the upper body portion. So look at our water bottles standing close to our chest, right? You don't want to have them here, just really wanna naturally bring them up. Not too high up, just where it feels comfortable, depending on your range of mobility. If it's up there, perfectly fine. If it's too light, get bigger bottles, no worries. If it's too heavy, no bottles is fine too. You're still working your shoulder, trust me, without a weight. And rest for 20 seconds. I'm gonna keep walking for these 20 seconds. I told you, this is an intermediate class. And then we're gonna go back to our water bottles and do lateral raise. Let me show you how it works. So, lateral raise. Starting here, I'm just gonna open up here, right? Open up. Oh yeah, you keep marching. Forgot to tell you that, sorry. Gentle, you see my arms are extended. My back is straight, my shoulder blades are tucked back. I want my shoulders down and back. This is how I make sure I focus on the right muscles, my shoulders, because it's a shoulder workout. Couple more, and then we're gonna be resting. All right, 20-second rest. Still going. The next movement is gonna be a calf raise. So calf raise is gonna be standing or holding a chair if you need support, or sitting down with your water bottles on your knee, and you're just gonna go up gently, all right? So Nick is gonna do it seated, I'm gonna do it standing. If you want a little more stimulus, why don't you take your water bottles in your hands, your calf raise. If it's too heavy, drop them down, no problem. And put them down, not literally drop them down. You get it. That's it. You can hold a little bit at the top if you can. Yes. Gives you a little more activation in the calves. Super important muscles for your stability, walking, and overall functionality. Whoa. That's it. We're gonna rest, marching. So I have good news and bad news. The good news, we finished our first round. The bad news, we have 2 more. But overall, it's not that bad, is it? We're gonna go back to our forward lunge in 3 seconds. All right, round 2. Let's go, folks. Let's go. That's it. This is a great movement. If you've taken a 6-minute walk test as part of your cardiac rehab program, and if you want to improve your 6-minute walk test, I'm giving you a tip. This is a great movement. Gonna be walking much further. And rest, marching. And then back to our standing row. Get those water bottles. All right, standing row. Still marching. Why don't you hold at the top this time? Boom. Hold 2 seconds at the top and bring it back down. Hold and back down. Remember, never ever hold your breath. A couple reasons for that. Number one, holding your breath while exercising, your blood pressure goes up by a lot, trust me. And second, it can give you normal heartbeat. We don't want that. All right, one last before we take a marching rest. Yep. All right, lateral raise. Done that before, still marching. Hold at the top if you can. Make it a little more challenging. If you can go up to there, because your shoulder mobility is not there, that's fine, no problem. It's gonna come over time, don't worry. Here you go. All right, those water bottles go down or not. I'm gonna keep them for my calf raise. I'm gonna rest 20-second marching. And then we're gonna go back into our calf raise exercise. Calves are super important. Don't forget them. All right, calf raise, let's go. Water bottle in my hands because I want a bit more challenge. Up and down. Why don't you hold at the top? More challenging, is it? If the water bottles are too light when you're standing, get bigger ones, that's fine. Calves are powerful muscles, you can load them. Couple more. And that's the end of our round 2. One last. We're getting there, we're getting there. Done 2/3 of the main workout. Remember the conversation test? Should be mildly out of breath. Not able to hold a full conversation. It's exactly where I am right now. All right, back to our forward lunge, Nick. Let's go. Oh. Hold it, we're not done yet. Couple more. And rest. Whew. Next up is standing row, our last for today. All right, 40 seconds of standing row, let's go. All right, let me give you a challenge right now. Hold, pull out, bring back in, and down. If you can't do that, just do the regular row, that's fine. I'm gonna do the challenging version. I feel like it today. You don't have to. Ooh. And rest. If you have a heart monitor, why don't you take a look at it? Where are you? Are you in your right zone? Or are you not pushing enough? Or are you pushing too much? Just adjust. Lateral raise in 3. All right, hold. Ooh. Hold. Couple more. This is the last for today, folks. Don't drop just yet. Couple more. Yeah. Ooh, it's burning. And that's it. Rest. Ooh. That's a good workout session. Now for our cool down part, the first movement will be knee raise with a little twist, because you know me, I like to add a little twist, literally actually for today, because I want you to raise your knee and twist to reach to the other side with both hands. So we're going for 1 minute, whether you're standing or seated, that's it. Twist, keep your core tight, your abs engaged at all time. Twist, twist. If you can twist, just at least bring your hands on each side. Good abs workout there. Couple more. Yeah, I know my chairs are creaky. Perks of working out at home, folks. I'm sure you have creaky chairs too. All right. Next movement is hamstring stretch. So hamstring stretch, whether sitting down or standing up, I want you to lift the toes. You have your other foot planted in the back. Just lean down gently. Keep your leg extended. To make sure your leg is extended, why don't you push on it like that. Push on these legs. All right, switch legs. So toes pointing up, foot flat. I'm gonna push right above my knee to make sure my leg is extended and my toe, point them up as much as I can. But I want a 3 on 5 pain level in your hamstring, so at the back of your leg, which is what we're trying to stretch. A good stretch requires at least 30 seconds on the muscle you're targeting. No less. All right, we're gonna switch to our last stretch for today. So quad stretch. Quad stretch, use a chair if you need, a wall, anything to support yourself. I want you to raise one leg. I'm doing it without support because I'm working on my ankle stability. So if you can hold it, great. So I wanna push my heel against my butt in the back and just try to stay straight, and a gently stretch. You should be feeling your quads right here. All right, you're gonna switch legs, so bring it back down, other legs up. Ooh, don't open your knee. Your hip should be facing forward. Always have one leg that is much more stable than the other. I don't know if you noticed. Ooh, this is much easier for me than the other side. And bring it back down. All right, that's it for today, folks. Nick, thank you so much for being with us today. Thank you, folks, for taking the time to make your heart stronger. You're getting better every day. Come back to working out. Remember, 5 times a week at least. That's very important to protect your heart. I'll see you next time. Until then, take care. Bye.